भारत में 13,88,000 रजिस्टर्ड एलोपैथिक डॉक्टर्स हैं एंड 7,51,000 रजिस्टर्ड आयुष डॉक्टर्स हैं। मतलब कि हर 10 एलोपैथिक डॉक्टर पे 6 आयुष डॉक्टर्स अवेलेबल है। एंड दिस वाज पब्लिश्ड बाय मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर ऑन 10th of Feb 2026. Now we will discuss the first ever all India survey on Ayush done by NSSO in 79th round in session of 2022 to 2023. The objectives are on the awareness of people about the traditional system of healthcare, uses of the Ayush for prevention or treatment of ailments, and for prenatal and postnatal care, and awareness of households about home remedies and medicinal plants. The interesting thing is that the awareness ratio is exceptionally high. It is 94.8% in rural people and in 96% in urban people. But the contrast is here that the survey which mentions the usage of Ayush in last 365 days is very different. It is only 46% in rural areas and 52% in urban areas. So why is this so? We don't know. और सबसे interesting fact क्या है कि only 26% of that 52% people used Ayush as a curative medicine, therapeutic medicine. मतलब कि सिर्फ और सिर्फ 26% of 52%, मतलब कि 13% people out of 96% aware people are using Ayush as a curative medicine, and 48% of that 52% people is using it as a rejuvenation, that is preventive medicine. मतलब कि अवेयरनेस बहुत ज्यादा है लेकिन मेन लाइन ट्रीटमेंट में कितना यूज हो रहा है? Only 13%. It's high time that authorities should position Ayurveda as the main light treatment. They should reduce the clinical standardization gap. There should be strong public health integration, and the topmost, the education and the social conditioning should be the first priority. And there should also be a funded research that why there is a communication gap, why there is a trust gap between the awareness and the first line of choice.